There was a study done, a Gallup poll done several years ago, that asked business partners across the country, what is it that nurses do? Why aren't they at the healthcare table? And what the business folks said was, they're not, it's not that we don't like them. We know they care, the number one trusted health professional, but we're really not sure what they do.
We do spend a little bit of time whining that we don't have a seat at the table and, our voice hasn't been heard on this. Well, you can't whine and then not be ready to put in the effort, to sit at the table until it's your turn, to respond to the media, et cetera. We've got to be able and willing to make that investment in talking with the media, et cetera, in order for our message to get heard.
I think we suffer by being invisible. I think we are certainly seen in other ways, but visibility is so critical right now, and the sky is the limit on what nursing can offer the public in healthcare right now. So being visible, being verbal, talking about it to the public is essential. Now's the time. I would tell them that's a missed opportunity for them, that this is really an opportunity for them to show what nursing does, how they make a difference, and be called upon by the public to contribute more.
I've been a part of, with communications and policy and government affairs folks, at the end of a press conference or a press event or an interview, sort of doing a little debrief of, were we on point with what we provided them, and could we have done a better job of that? And so I think, again, I keep making these clinical analogies. So when you have a bad outcome, you don't just run away and you can't avoid it. You look at, well, what could have contributed to that? Was there a better kind of training? Did we have all the tools that we needed? What could we have done to have a better outcome?
So I would offer nurse leaders to be cognizant of things going on around them, of the interesting things that media are picking up on. And Ebola is a perfect example of something that nurses were instrumental in working with and providing health care for citizens. And so to be able to talk about what nurses do in particular, what their part and role is vital.
You have to be a risk taker, and nurses are risk takers. If you care about getting the message out at all, you do not know how it will be perceived by the rest of the people. And even when the reporter might write something not necessarily the way you wanted it, it doesn't mean your message did not get out. And I've had that happen a lot.
The other thing that I think it's so important for nurses to keep in mind, that oft-cited Gallup poll about the trust that the public has in nursing. I don't remember exactly when it was in the process of what became the ACA, but there was a period where it really looked like it was going to go down the tubes, with all this work, couldn't really get an agreement of what was going to go through Congress. And the ANA got a call from the White House that they wanted to do a Rose Garden event with nursing and nurses supporting health system reform.
I am pleased to be joined by not only some of my former colleagues and outstanding legislators, but also by nurses. And I think I've said this before, I really like nurses.
The interesting thing about nursing is that very often when nursing is asked to weigh in, and very often when nursing comes to the table, our dog in the fight is the patient. And we're seen that way, but I think it's because that's really who we are and what we're about. We're there for patients. And so often our efforts are about giving voice to the voiceless.
I have found that to be true with most of the issues that I deal with from a policy position. people are amazed that I put the patient, this is a patient-focused effort with a lot of other issues, long-term care, military sexual trauma. I'm not talking about the dynamics of the agencies. I'm talking about the individual who is the focus of what we're trying to accomplish. And when you bring it on like that, it brings it down to earth, and it brings it into something that can actually engender the support of a lot of people when they get past the rules and regulations. It's how are we going to solve this problem for these individuals?